Thank you, Chairwoman DeGette. Today, we're going to hear from some of the nation's leading public health experts on one tool that could help put an end to the pandemic and the suffering, and that's a safe, effective, and trusted COVID-19 vaccine. And I'm pleased that you're all with us today so that expertise and science have their rightful place in these discussions. We all want a COVID-19 vaccine to be developed as soon as possible, but first and foremost, we must confirm that it's safe and effective, and we must ensure it is trusted and accessible to all who need it. But as I said in our July hearing with vaccine manufacturers, my fear is that the Trump administration might force the FDA to approve a vaccine before proven to be safe and effective in an effort to boost the president's political fortunes. I hope that doesn't happen, and I'm grateful that career FDA officials have repeatedly stated the importance of putting science first. Now, let me just say that since January, the president has consistently placed politics over science in the nation's COVID response, and he's undermined, in my opinion, the independence and integrity of our public health agencies and scientific experts. His words have created confusion amongst the American people, eroding their trust in our public health institutions. And so it's little wonder that polling now shows that public trust in the future COVID-19 vaccine has declined drastically over the past few months. But that's why we have to build back the confidence of the American people as we work to ensure a safe and effective vaccine is developed. Now, we're going to probably vote on an updated HEROES Act that was introduced yesterday, and included in that is $1 billion in funding for an evidence-based public awareness campaign to outline the importance of vaccines and combat misinformation, some of which is unfortunately coming from the president. In this new bill, updated HEROES Act, there's also $20 billion added to authorize the secretary to provide grants or contracts for vaccine and therapeutic development, $7 billion to conduct activities to enhance, expand, and improve vaccine distribution and administration, and also language to provide grants to state and local public health departments for procurement of vaccines and data and facility enhancement. And I would also remind everyone that the HEROES Act, as will this updated HEROES Act, provides free treatment, drugs, and vaccine with no copay. Similar policy that we had in CARES for testing and contact tracing with free testing, in this case, free vaccine and no copay. Now, of course, I regret that Mitch McConnell and President Trump have not, really stood in the way of the HEROES Act that the House passed back in May. And I continue to call on Mitch McConnell and the president to come to the table to negotiate a real help. And maybe, hope springs eternal. Maybe before we leave this week, we will have a consensus bill to follow up on the CARES Act that has this language and funding for the vaccines that I just mentioned. But unfortunately, what we continue to see from this administration is political calculations and not science guiding its decisions. And now, of course, the Trump administration is attacking a potential COVID vaccine in court because they want to strike down the Affordable Care Act, and they've asked the Supreme Court to do that. And remember, the ACA requires that health insurance plans cover all recommended vaccines without cost sharing for patients. So if it's struck down, then we'll lose access to health care, including a potential vaccine for those who lose their coverage under the ACA. And that to me is an outrage. So I look forward to hearing from the witnesses today. Well, I think the Trump administration's actions, if left unchecked, could actually hamper the effort to develop and administer a successful COVID vaccine. So for that reason, I hope our witnesses can advise the panel on what guardrails they hope to see in place to keep that from happening. That's one of the main reasons I want to hear from all of you, to see what you think we can do to prevent a situation where we don't have a safe and effective vaccine, people don't want to take it, all the other concerns that I've expressed. So thank you again, Madam Chair, and I yield back.